Hey guys, welcome to the second part of the video where we will make sense of the notification put out by NMC on their official website on the date of 28th of December 2022. Yesterday we talked about the general idea of NEXT and how next step 1 will be. Today we will talk about next step 2 and the other parts that's given in the notice. That's almost 5 pages of notice that which we will try to make sense of today. And don't worry, I will make short clippings of what I understood from this entire 9-page document, what it means for FMG students, what it means for UG students, and what it means for students who had already graduated and are waiting to get into postgraduate courses. So please stay tuned, please subscribe to my channel and ring that notification bell so that you will know when I'll be putting up those videos. And you can also follow me on my Instagram at Confused Indian Doctor, so you can find me over there Instagram, and I will try to put some reels regarding the same. So without further ado, let's get started. So now I am at the 5th page of this notification. In this, I will be now talking about next step 2. So they have told that next step 2 shall be a practical or clinical and viva voice covering 7 clinical disciplines. So unlike next step 1, this will be having 7 subjects, and the 7th subject which got added is orthopedics and PMR. So all the other 6 subjects are same as next step 1. Orthopedics and PMR is added extra, and then they have told that the examination shall be OSCE. So it might have simulated cases of patients, then other decision making and communication skills expected of an Indian medical graduate. That's what they are going to assess. So basically they will check your examination skills, then they will also check your communication skills. So communication skill was never checked in my entire 5.5 years of UG life, other than for a mock OSCE that we had, which was an exit test for our internship. So I think that was not happening in any other college. In our college, thanks to a few faculties who were interested in giving us an experience of how OSCE works, because that will help us in going outside India, because a lot of examinations outside India are OSCE, and so they wanted to give us an experience of that, and they conducted this. So we have had little experience regarding these OSCE exams. So other colleges, I don't think many of you guys will be having a idea of how OSCE will be. So OSCE will be basically a checklist. So the examiner will have a checklist with different points, and if you complete one task, you will be marked like there'll be a tick mark. It's not subjective, it's full objective. So if say hand washing, so if you are doing each and every step of hand washing, you are getting full mark. If you miss one step, there is no half mark, you are getting 0 for that. So like that, they will have checklist for each and everything that they are going to assess, and then they will give you mark. And they have also told that next step 2 will be a pass or fail examination. It's not gonna be like next step 2 marks will be taken for anything. It's just a pass or fail examination. And they have told that the examination shall be held in person or live and shall be conducted by respective state health universities or institutions. So basically what they are saying is it will be conducted by your own college, and there will be next step 2 every year once, just like next step 1. And next step 2 supplementary will also be held, and it will be restricted to those candidates who have failed in 1 or more up to 3 subjects of the 7 subjects and are also required to repeat particular subjects. So what they are telling us, next step 2 supplementary can only be written by people who have failed only in 1 to 3 of these 7 subjects. So if you have failed in 4 of these subjects in the next step 2, then you won't be able to write supplementary exam. You will have to write it next year. And they are also told that and are required to repeat particular subjects. That is, if you fail next step 1, then you will give both next step 1 and step 2 in supplementary of that particular subject. So you have passed all the 5 subjects other than medicine in next step 1, then you will only give next step 2 in that main exam of all these 5 subjects, not medicine. The medicine you will give next step 1 as supplementary and next step 2 as also supplementary. That's what they have told here. Then in the next point, they have told that those who do not pass both the next step 2 regular and supplementary examination, just the same thing. Like if you don't pass both, then you will write it next year, just like next step 1. Then there is no restriction to the number of attempts, like same thing again, like there is no restriction in number of attempts. You have to just finish next step 1 and step 2 within 10 years of joining the MBBS course. Then we will go into the next part, that is next course. So this is a very interesting part, and I think this will matter a lot to the people who are watching my video. So the marks in next step 1 shall be calculated as whole number. What they have told here in the first point of this nature of scoring is that next step 1 will be marked. It's not a pass or fail examination, it's a mark based examination, and these percentages will be used for PG admissions and everything. And next step 2 is just a pass or fail examination. There is no mark, you either pass or you fail, and it is depending on like the OSCEs. If they have put that 2.5 marks is required per station, like where the total mark was 5 marks, how much ever you score, 2.5 or 5, you just pass. They are not going to put the marks out. So that is what that means. Then they have told about the minimum score for passing. So in next step 1, they have told that passing mark will be 50%, 50 out of 100, or half of the maximum possible raw for next step 1. So they have told this half of maximum possible raw score because in some exam, if 1 or 2 questions are cancelled, then it won't be 50% of the whole mark, it will be 50% of the maximum possible mark. So that is there. Then you have to pass each and every individual subjects, like you have to pass medicine, you have to pass surgery, you have to pass ENT, you have to pass ophthalmology individually. That means you have to score 50% marks in each of these individual subjects, each of the 6 subjects. Then only you will be able to pass the examination. Then the next step 2, just I told just now, like you will either pass or fail depending on acquisition of competencies that are evaluated, and that shall be declared as pass or fail. So basically whatever skill you gain during internship, how to talk to patients. So they have told about communication skills also. In communication skills, basically breaking bad news to patient and their relatives. So actually I feel that this is required in India because more often than not, we are not trained in communication with the patients or their relatives or even with our own colleagues. So there is a lot of problems happening in our country because of that. And I think because we are going to conduct an exam where communication skill is going to be evaluated, the colleges will teach their students how to communicate with their own colleagues, the patients and their relatives, and how they are going to convey really bad news to the patient's relatives so that they won't be coming out and beating you. But I don't know how far this will be helpful in reducing the violence against doctor, but I feel this is a step in the right direction. So now let's go to the third point. In the third point, I have told that calculation of next step 1 scores for determining merit for the purposes of admission to postgraduate courses in broad specialities. So basically how the marks will be taken for PG admission, that's what they are going to discuss in this part. So the total marks will be the sum of marks in each paper. So that means like they won't be taking any average or anything. They will just take individual mark, add it up, and the total mark will be used for giving admission into different specialties. So like if you got 50 in everything, all the 6 subjects, then 300 will be your mark, and that mark will be used to give you a rank, and according to that rank you will get into a PG course. Then if you fail in one subject, like you failed in, let's say, pediatrics, so all the marks that you got during the step 1 normal exam of all the other subjects will be taken, and the mark that you attained for pediatrics in the supplementary exam will be taken. So that will be used to assign a mark for you and to give you the rank. So they won't be calculating the marks from the subjects that you have failed. They will only take the marks from when you pass that exam. Now the problematic 2 points are coming. Okay, just hear this out. In the third point, they have told that the total marks percentage of those candidates who have appeared in next step examination to improve their scores shall be calculated from the average or mean of last 3 consecutive scores. So what they have told here is that a person who wants to get into a PG admission is giving next step 1. All right. So now in 2024, he gave next step 1. Like, let's imagine. then he didn't get a good rank, so he's not going to take that seat, so he wants to improve his score. So he goes and writes in NExT in 2025. So in 2025, the mark which he will obtain won't be used for for determining the rank and getting him a PG seat. Instead, the marks that he got in 2024 and the marks which he got now, that is in 2025, they will be averaged, and then with that average marks he'll be given the rank, and that rank will determine his PG seat. Like that, it will continue for 3 years. That means that your person writes in 2024, 2025 and 2026, those 3 marks will be taken, and that will be used for giving him a PG seat. Then if he again writes in 2027, the 2024 mark won't be calculated. The 2025, the 2026 and 2027 marks will be calculated, averaged, and he will get a rank. So if you want to crack NExT and get a good PG seat, then what you have to do is, if you are writing, you write it obviously for passing your MBBS degree. So after that, if you want to improve, I would say wait for 3 years, don't write the exam, wait for 3 years and write after that only. So let's take this scenario. A person is writing their NExT step 1 in 2024 to pass their UG degree. So he or she passed that degree, but he or she didn't get enough rank, like a good rank to get him or her into a specialty that he or she likes. So he will have to repeat, obviously. So don't repeat in 2025, don't repeat in 2026, repeat in 2027. If you write in 2027, the scores that will be taken are from 2027, 2025 and 2026, like 27, 26 and 25. So then the average will obviously be only the score that you get in 2027, because you haven't written the exam in 2026 and 2025. So then they have told that for the purpose of determining merit, especially for admission to broad specialty postgraduate course, the NExT steps course shall remain valid for 3 years. So I don't know like what they actually mean by this. So just like the person whom I have talked about before, the 2024 person who wrote the NExT step 1 in 2024, his score shall be valid in 24, 25, 26 and 24, 25 and 26. All right. So he will be able to get a PG seat in that 2024 counseling and 25 counseling and 26 counseling. That's what I am thinking. So if he has not written in 25, then he can actually apply for postgraduate degree counseling in the next year also with the same score, because these scores are valid for 3 years. So this is like USMLE, your scores are valid for 8 years. So you can go for different matches every year for all those 8 years with these scores, with the same score you got in the first time. But that is not the case anymore with USMLE, because it's a pass or fail examination now. But it is going in the same direction. NExT is like trying to be another USMLE. Then the utility of NExT course: eligibility for professional registration in appropriate body to practice modern medicine as an intern, and eligibility to pursue internship as governed by the again, there are a lot of spelling mistakes and grammar mistakes in this. So what they have told that you have to pass step 1, NExT step 1, to get a professional registration to work as an intern. Okay, so to work as an intern, to get the professional certificate, you have to pass each and every individual subject 6 papers. That's what they have told here. And you have to also pass the part 2, that is the practical or clinical examination, which will be conducted by your college. So you have to pass NExT step 1 and you have to pass the practical examination, which will be conducted by your college, to get the professional registration. That's what they have told here. For FMG students also, if they want professional registration, they have to pass NExT step 1, all those 6 papers individually. There is no change, there is no difference between FMG students and the people who are studying in India. So in the next point, a medical graduate who has qualified in India for overseas shall be eligible to be registered in the Indian Medical Register or State Medical Register and licensed to practice modern system of medicine in India, provided that all of the following are met with. So this is concerning people who are trying to go out of India after getting an MBBS degree in India. So for them also, if they want their name to be there in the Indian medical register, they have to pass step 1, next step 1, then they have to do the 1 year compulsory internship, and then they have to pass step 2 also. Then only they will have a permanent registration and their name will be there in the state or national medical register. So it's like nothing new. Then they have also told that any other requirement as may be considered appropriate by commission or concerned authority, institution, and duly applicable at that time. So I forgot to tell you this, FMG students doesn't have to pass a practical examination. Obviously their college is not there in India to get the provisional registration. They just have to pass next step 1. Like given that they have completed and they have like gained all the competencies that they have mentioned, that the NExT will be mentioning, that the NMC will be mentioning. Now the next point. So now they have told about all this, where the next course will be utilized. Now in the next point, they have told that eligibility for admission to postgraduate medical courses in broad specialty subjects like PG admission. They are talking about PG admission. So all those people who have their name in the state or national medical register will be allowed for postgraduate medical course. So what that means is that you have to pass next step 1, you have to pass your college practical exam, then you have to do your internship, then you have to pass next step 2, then only you can go for postgraduate medical course. Then in the next point, they have told that has participated in a process through mechanisms such as common counseling by designated authority approved by the commission or central government. Only the actual raw marks, just like same thing they are repeating again, like they will only take the raw marks from the step 1 for determining their rank and merit to give a seat. Then utilization of NExT course for purpose other than the above. So utilization of NExT course for things which I have not mentioned, that is for giving the permanent registration for a PG degree, they will be used for other things also. So like if some other organization wants to use the NExT code, then they can just approach NMC and they will give the permission and they can use the NExT course for the same. So what this means is that currently, if you take the case of AIIMS Delhi, if you want to work there as a non-academic JR, they will ask your rank in INICET. So if a person with a good rank in INICET is coming, then they will give that non-academic JRship to that person, not the one who doesn't have that much merit. So I think this NExT score shall be used all over India for jobs like this, non-academic JRships and other medical related jobs. So they will also start utilizing NExT and NMC will be giving permission for that. That's what I feel what they are meaning here. Then in the chapter 3, general information, so they have told the objective of NExT step 1. So that I have told in the first video only. So it's so that I have told in the first video only. The exam will be based on high quality MCQ and it will be a national and they will ensure a nationwide delivery and conduction with robust fidelity in a secure manner, and the MCQ items would address higher domains of knowledge aligned with to competencies expected of an Indian medical graduate or a graduate practicing modern system of medicine, especially in India. All right, so they have just told that the standard of medical practitioners in India are going to be a bit higher after NExT is implemented. So that's what they are meaning here. Then distribution of items and knowledge level of questions. So what kind of questions will come for NExT? To ensure assessment of higher domains of medical learning, a majority of items shall test higher level comprehension, analytical skills, clinical problem solvings that are aligned to competences. Then NExT step 1 format is intended to discourage rote learning by the medical students. Okay, that's nice. Then case vignettes or clinical case scenarios shall be the overwhelming pattern of examination. So the exam will have a lot of clinical case scenarios and clinical vignettes. That's what. So almost many of the questions will be just clinical case scenarios. A patient came to a accident and emergency like this, and these are his files, like that will come, and a small question will come in the end. It won't be like you will be asking like, which nerve causes this. They won't ask like that. Most of the questions will be a clinical scenario. And then they have told about what kind of questions will be coming. So problem solving and analytical skills will be 65%. Clinical evidence are 65%. That is like 15 per hour of examination. So per hour of examination that you're writing, there will be at least 15 questions of this type. Then comprehension type 25% and recall type 10%. So they have increased the clinical scenarios by a lot, I feel, compared to NEET and ENICET and all. So that's all. Then they have also told that variation in the distribution may be expected. So it is ambiguous. They can just change this distribution whenever they feel like. Then the level of knowledge related to the acquisition of competency shall be approximately. So must know topics 60%. So if you read all the must know topics, you will definitely pass, because it is comprising of 60% of the question that will be coming in next. Then nice to know 30%, then may know 10%. This nice to know topics are like above average students will be knowing, and these may know are like overachievers in your class will be knowing that may know topics. But I don't think this may know topic will actually make a big difference in your performance in the papers and all, but it's okay. That's how it is being distributed. Then papers and distribution of subjects. So this is a big thing. Next point, papers and distribution of subjects. So just like I've told before, there'll be 6 subjects, but now they have given clarity about where FMT and PSM, that is community medicine, will be put in. So they have told that applied aspects of all other subjects of MBBS, including forensic medicine and toxicology and community medicine, will be mainstreamed into the relevant clinical subjects. So out of the 6 subjects that you are going to write, there'll be some questions from FMT and some questions from PSM integrated into that. Like in pediatrics, they will ask about RBSK, something like that. So that is there. Then in each paper, 10% items will pertain to applied aspects of anatomy, physiology, biochemistry, microbiology, pathology, pharmacology, forensic medicine, relevant to the subjects evaluated. In each paper, 10% will pertain to applied aspects of public health. So they have given a lot of importance to PSM. In every paper, 10% of the questions will be coming from PSM, and another 10% will coming from all the first and second year subjects. So they have given a lot of value for community medicine. So in every subject, if there is a community medicine part, you just have to read that, because 10% is coming from that. And I feel that it is going to be a very small topic. Like in OFTA and all, if 10% is coming from community medicine, you can definitely get those questions. Like there are only a very few things which come in OFTA under community medicine. So that is there. Then the following table 1 provides the subjects in each paper. Papers will, like, now this table will give you an idea about how many questions will come and how much time you will get, and the proposed time schedule for the papers. So medicine will have 120, surgery will have 120, OPG will have 120, then pediatrics, ENT and OFTA will have only 60, and the duration will be 30 hours for the subjects which are having 120 questions, and 1.5 hours for the subjects which are having 1.5 hours. And the proposed timeline is that medicine and allied subjects will have 3 hours on the first day, then there will be a 2 hours break, then in the afternoon there will be pediatrics, you will have 1.5 hours for the same. Then the next day will be preparation day, rest day, holiday, whatever you want to call it, you can call it. Then on the third day, again surgery and allied subjects will be there for 3 hours, then 2 hours break, then END for 1.5 hours. Then fourth day will be a break again, then fifth day OBG for 3 hours, then 2 hours break, then again OFTA for 1.5 hours. Then information regarding next step 2. The next step 2 shall be a comprehensive practical or clinical examination to be conducted, blah 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 blah, whatever I have told before. Each examination would comprise of actual cases, OSCEs and simulations if possible. I don't know, like in how many colleges around India there'll be simulations of different scenarios, but in our college there are actually mannequins which are capable of doing these things. Like there is a mannequin which will tell you if you are doing the CPR properly. Then there is another mannequin where you can hear the fetal heart rate. So that mother mannequin has a child mannequin inside, and then there is a control button outside where you can adjust the FHR of the baby. So with the stetho you can put at the right place and you can hear the fetal heart rate and all. So like this high-tech devices are needed to do simulations, but we Indians are very creative when it comes to expenditure. So I think that like the teachers at those colleges which doesn't have a lot of fund or things available, they will find some creative way to do these things without utilizing a lot of money. So I think simulations will also be there at a lot of places, but it won't be the same. And then they have told that depending on the ability of satisfactory performance or unsatisfactory performance, there shall be only 2 levels of it. That is, in next step 2, there is only pass or fail. There is no mark. So that is there. Then the distribution of subjects, like I have told, there will be 7 subjects. Like that is all the subjects that is there in next step 1 plus orthopedics and PMR. Then they have told that the time schedule of next step 2 they have been mentioned now, so that will be decided later. Then time schedule of next examination, associate events. So this is a very, very ambitious time schedule, I would say, and I have some doubts regarding this time schedule. So they are trying to like this is not the final time schedule. This is something that the government has proposed, that the NMC has proposed, and they have told that this will be changed from time to time. So let's see this time schedule, shall we? Okay, so next step 1, regular examination. That is not supplemental, just regular examination. It will be second week of December. Then the result of this exam will come in second week of January. That is exactly after 1 month. Then next supplementary exam will happen, I don't know, sometime in the February or sometime in the last week of January, which I'm not sure. They will talk about that later, I guess. Like in the further notification they will tell about that, I feel. Then final MBBS part 2 or third MBBS practical examination, that is practical examination that will be conducted by your college, will happen in the first week of January, and that result will come in the 4th week of January. Then internship will start from 1st February and it will only end in the next year, 28th of February. So it's not 1 year, it's 1 year and 1 month, like 1 year and 28 days of internship. So I have only done 1 year of internship, and all of you guys will also have only done 1 year of internship, but after next you will be doing 1 year and 28 days of internship. That is a change which they have got. Then next step 2, regular, will happen in the second week of March. That is after you have completed the internship. That is not the year when you wrote next step 1. If you write next step 1 in 2024, you will do your internship in 2025 and 2026. That is from 2025 1st February to 2026 28th February you will be doing your internship. Then you will give next step 2 in second week of March in 2026, and then next step 2 result will come in first week of April. Then there will be next step 2 supplementary. Then postgraduate admission will happen in May or June, and the result will come in 30th June. That is, the counseling and everything will happen in 2 months, and the result will come by the end of June, and the postgraduate course will start from 1st of July all over the country. That's what they are saying. So the doubts that I have is, if a person is writing next step 1 in 2024 for the purpose of getting a professional registration, then doing internship, then getting the permanent registration, his 2024 score will only be utilized in 2026. That's why they have told in the beginning that the scores will be valid for 3 years, because otherwise it can't happen, because that's how the timeline they have decided. So it is a very well thought out procedure, and it's a very well thought out timeline. So I'm like very impressed by the amount of planning that has gone into this. So that's why they have told that 3 years, and if a person is giving in 2024 December, then he will finish his internship by 20th February of 2026, and then he will start his PG course from the 1st July of 2026. Then the doubt I have is, there'll be people who wants to pursue who wants to just improve their next step one course and get into a PG course, or who just want to get into a PG course. So those people will be writing in December, and then I think that they will be getting into the postgraduate course the very next year, July. I feel so. So a person who has written NExT in 2024 for the, like, he was a UG student who wrote NExT in 2024 to pass the MBBS, and a person who is writing in 2025 December to just get into a PG course, both of their scores will be utilized in 2026. That's why I think they have told before about the normalization of scores, because obviously if you write in 2024 December and you just want to get into a postgraduate course, you shouldn't be made to wait 1.5 years to get into a postgraduate course. So I think this is how it will work, but there is some ambiguity there because it is not clear what is the timeline for these students who are just writing NExT to get a PG seat. So that's all for the video. Then now I will try to make short videos of each and every part of this document, like what it means for FMG students, what it means for UG students, and what it means for PG aspirants. And then I will talk about next step one, what are the subjects, how the questions will come, all those things I will cover in small videos, and I will try to put it up as shorts in my channel and also as reels on my Instagram. You can follow me on Instagram at confused_Indian_doctor. So I will be glad to hang out with you guys on Instagram. You can message me also on Instagram if you have any doubts regarding this video. So do subscribe to my channel and ring that notification bell so that you will know when I'll be posting those videos. So that's all for now. Bye till we meet again.